Good morning. Before starting grand rounds this morning, we're going to have an orientation to the new POMA form with Dr. Gabriel, Dr. Tsega, and Dr. Rhee.
Good morning, everybody. Thank you very much for having us here today. We're going to keep this very, very brief. A quick background for those, I think everybody in this room now knows what a POMA is. The intent was to create a preoperative medical assessment to better prepare folks for surgery. And although I would love to have a very lively conversation about the thinking behind the POMA and why we're doing it, as well as some of the challenges, we only have 5 minutes, so I'm always free. You can give me a call. We can talk about it offline. But today we're going to introduce the new POMA form. So recognizing that the workflow challenges are real, our group was charged with trying to make that a little bit easier. And that came in the form of reworking the POMA form. Quick review, anybody who needs a POMA, anybody whose BMI greater than or equal to 40 needs a POMA. That includes ambulatory patients and DAS patients, which are those patients who come in and stay on the day of surgery. If you're ASA 3 or greater, you need a POMA, and you're automatically ASA 3 if you're BMI 40 or greater. So it's just easy to remember, all BMI 40 or greater, and DAS, ASA greater than 3. These are just some sort of nitty-gritty rules that have come along with it. These are for folks in the main OR. But we have looped MRI under MAC, IR cases. Cystoscopies is a common question because previously they were not included, but they are. DNCs and PAS cases are included. Bronchoscopies in the operating room are, again, basically anything in the main OR, as well as MRI and IR, because Rob Lickstein was very enthusiastic about this. Folks that are not included are age 21 or younger, and that was as defined by how we define pediatrics here in the hospital. And cases outside of the operating room. Transplant surgeries and cardiac surgeries are also exempted because they sort of have their own process. It's not like they don't do a POMA, they have their own process at this point. All right, so very quickly, the workflow as it is now is that we have a POMA navigator tab. And you may recognize this also as a rounding tab, and our POMA hospitalist folks are going to explain that a little bit more. But we need to have this tab because it allows for functionality of the note that we need in order to have surgeons attest, have those notes go where they need to go on the day of surgery. So we had to keep that. But what we did was we made all of these different aspects, the sections, much simpler. You may recognize on the outpatient side, you may use fat tabs. It's a similar sort of concept. There's a pre-op navigator or rounding tab. A floating navigator may look like this. These are all ways that you can access the POMA note. So again, what we did was we greatly simplified the sections, and we made the note and we transformed the note largely into a smart list or smart text note, which is much more similar to our usual workflow, which we thought would be easier for folks. And this, by the way, we included medicine doctors, outpatient folks, people who have different workflows and got their feedback and developed this workflow based on the feedback we got from folks writing the POMA, which we thought was logical. So this is where we are. We did have something that looked like this, and now we have something that looks like this. So this is for outpatient, and basically what we did was we largely simplified this section part. And for the inpatient part, it's even more simple. And the reason why it's a little bit different is because there are different necessary functionalities for the outpatient piece versus the inpatient piece, as you know. All right, so essentially this is what we have. You go to your Preop Assessment tab. You fill out the past medical history and allergies. And the reason why we have you click on these individual sections and fill out, and you know these expand to different buttons. The reason why we kept those is because that allows for auto-population in subsequent notes that other practitioners are writing, and we felt that that information was very important. The rest of it is in the Create POMA note hyperlink. So you click that, and it brings you to a smart list page, and that's how you write a POMA note. It's much more simple now. So essentially, this is what you've got. And this is a previous draft, and I'm going to hand it over to our hospitalist now to show you what it looks like in our most current form, but it's a smart list now, largely.
Okay, so hi everyone. Very quickly, what you have here is the inpatient POMA. So just like Amanda said, you have the rounding tab, which is on the left-hand side of the screen. And after you fill out the medical assessment and the allergies, then you click Create POMA Note, and this is what you get. So the template looks a little similar with the gray bar and whatnot for POMA, but the organization is a little bit different. And so as you can see, there are different drop-down menus that you can select, and you can multi-select various different additional relevant history that may not necessarily be in the medical assessment, such as morbid obesity, this patient is a Jehovah's Witness, etc. And then two other things that we sort of added in this iteration of the form is one, we separated out the cardiac risk assessment and the overall risk assessment. So here you see a patient is either at low or elevated cardiac risk, and then their overall risk of surgery is either low, intermediate, or high, taking into account that someone may have an RCRI of 0, but they may have cirrhosis, so they are still at a high risk for surgery. And this is what you end up getting. This is the second part of the form with the recommendations. If you remember the current form, the recommendation section with the formatting, it's kind of hard to actually find what the recommendations are. So now it's much cleaner and just a little bit more organized in a more intuitive format. The outpatient POMA, as Amanda mentioned, you can get the Pre-Op Navigator from the More Activities tab, and then same thing, create a POMA note, and that's pretty much it.
All right, I put this up here, and you all are the first place that we've announced this. We'll be going live this week, but if you'd like, it's still under construction right now, but we'll be going live probably this week. If you go to this URL, you can download an app which has information about how to write a POMA, who needs a POMA, who to contact in case you have any questions. Just again, trying to make it easier for everybody to work in this workflow. And that's it. Any quick questions? I'm going to leave our names up here so you have our contact information. Feel free to contact any one of us. We're happy to answer any questions and even discuss the theory behind POMA. Okay, thank you very much.